How can I help you today?
So I've never seen a dermatologist before, so I'm here today because basically I just want to learn more about my skin type, and just different products that I can use to have more healthy, glowing look. And I just want to look youthful well into my 70s and 80s. And
So kind of a long-term plan then?
Yes.
Okay, awesome. So you brought some stuff that you wanted me to look at too?
Yes,
so
I
let
did.
me just get it for you. And are these things that you use frequently or just once in a while? Or
This I use pretty much every day. This I'll use maybe like once a month. Moisturizer I'll use daily.
This is every day? It says protein, peptides, and aloe. Cool. So this is probably really moisturizing, and the peptides will help to restore the kind of the moisture barrier, and that's like thin skin around the eyes. So this is probably a good product. Does it have a strong smell? Not really, so this is probably good. So you want to kind of avoid anything that could be a sensitizer for allergy, like fragrances. This one, witch hazel, cool. So this is a great, and aloe vera, so a great combination of ingredients that could help to just sort of cleanse and tone your skin. Alcohol-free, cool, paraben-free. You have good taste. Wow, these are good. So, and the rose water, that's nice and soothing, actually. Doesn't tend to cause much in the way of allergy reaction. Great, it has everything on here. Glycerin, that's a good moisturizer. It does have fragrance in it. It's listing here. Which may not be a bad thing for you, but you know, if you get really dry, this might start to cause some irritation. But the second ingredient is aloe, so this is probably soothing at the same time that it's cleansing. So far, so good. This one, I don't know the brand. I don't know these brands at all, actually, but so it's hydrating with hyaluronic acid, which is it helps hold on to water. So when you have this on your skin, you keep that skin, you know, well hydrated. If there's a scent, though, again, you know, you always want to do like the sort of scent test. If you have sensitivity. Do you have sensitivity?
I do, actually.
Okay. Yeah. So this one doesn't bother your skin?
No.
Okay. Yeah. This one, well, yeah, I've heard of this brand. Turmeric. That's actually interesting because I've heard a lot about turmeric lately being a nice kind of soothing and healing ingredient and anti-inflammatory, especially when people take it by mouth.
Yes.
Oh, it's a mask.
Okay. Yeah, it's a mask.
Okay, cool. Yeah, it smells like there's no added fragrance. So yeah, when I go to the store and I'm looking at stuff, this is what I'm doing. I'm sniffing, I'm checking. So it looks like it's a great combination of things. But there are some things missing from this that you could, since you asked about long term, you know, what can you do until you're 70 or 80 to really start now and really, I can go over some options.
Yeah, that'd be great.
Yeah, so basically, what is your primary goal? Like if all those things that I just mentioned, you know, aging skin, pigment, wrinkles, what would be your number one kind of focus point?
So I have just like a combination skin type.
Okay.
So, you know, T-zone, oily, and then just kind of here is where I get mostly dry, and sometimes I'll just
Do you mind if I kind of look closely?
Yeah.
Okay. All right, so. And you just recently had a baby, so how was your skin during the pregnancy? Did you have any changes there?
Not so much.
Okay. So do you have anything on right now, just like any moisturizers or sunscreen? Okay. When I'm looking at your face, I mean, again, like I said before, you have great skin. I don't really think we need to fix any problems, but to promote and maintain what you already have, I would keep using a good moisturizer. What you can do, so your morning routine, I would keep it the same, but add a sunscreen. Thing with sunscreen to look for, basically you want to use a product that has the mineral-based sunscreen ingredients, so either zinc or titanium. Also looking for something with an SPF of at least 30. That's kind of your minimum. They used to say 15 was the minimum. That's no longer considered the case for like cancer prevention and pigment prevention. So 30 to 50 is the best range to look for. Okay. If a company says, oh yeah, this is a 70 or 100, it's really not any better than 50. So there's the graph on that, it plateaus at 50. So the numbers, you know, just be aware of that so that if you're at 50, you know you're basically the highest. So that's great. So you could use, do you use like a makeup remover or anything else in addition to?
So I don't usually, well, yeah, if I'm wearing makeup, yeah, I'll remove the makeup. But,
okay.
I'm usually not wearing too much.
So that's great. So I just want to point out that you don't have to strip all those wonderful moisturizer and oils that you have on, and you don't have to use a scrub. A lot of people use these, you know, like exfoliating scrubs that have like grit.
Yeah.
We don't recommend that in dermatology. It's too traumatic to the skin, even normal skin, but certainly for like sensitive skin. The grit causes little micro tears and trauma that can cause problems. And then I see the patients later and they're saying, I don't know what's happening. And we go through the products and we discover, okay, this one maybe is causing that. So just for future reference. But there's other ways you can exfoliate that are effective without causing that kind of trauma. So yeah, so in the evening, that would be your time to do your anti-aging regimen. You're going to do this 3 times a week. So on the evenings that you're going to treat for your anti-aging treatment combination of things, you can do your cleanse and then dry off your skin. And then I like to use glycolic acid as a gentle exfoliator. It's actually pretty strong, but so it'll really get rid of the dead cells and really without causing no trauma and not a lot of irritation. And then the next step would be a retinol of some kind. And there's retinol products that are prescription grade. There are retinol products that are medical grade that are the same potency. And then there are over-the-counter retinol, or products that contain retinol. So retinol is basically vitamin A, or synthetic vitamin A, which is a vitamin that helps to change the way your skin cells behave, and your oil glands behave. It helps to regulate oil production, pore size, collagen production over time. That takes a while, but if you use it regularly, those are the things that it does. It also helps with managing acne, so that's why I like it. It's definitely, if you're going to pick maybe just 1 or 2 things to do on a daily basis, or it would be good quality sunscreen and retinol. If you just had to totally streamline it, it would be those things.
Oh, okay.
One of the things that happens as we get older, so since your question again, going back to how do I keep my skin healthy over time, is our skin loses its ability to maintain the surface barrier. So you want to find something that has things like ceramides, glycerin, hyaluronic acid, these ingredients. These are things that some of them form that lipid top layer so you don't have evaporation. And that's like ceramides, whereas glycerin and hyaluronic acid, they hold on to water. Okay. So you're kind of plumping, but you're sealing.
Then actually another question I had, I have just a combination skin, T-zone and oily, as you have already seen. But is there a reason why that happens, or is there products that I can have to get more well-balanced skin?
Yeah, that's a super great question. Most of us have a combination of those 2 skin types, and they can be worse or better depending on certain factors. And the anatomy of the facial skin, or microanatomy, like the nose is really different than the eyelid skin, for example. Like really different as far as the structures that are there. Most people don't have just one kind of skin. Most people have a variation, and depending on the time of year and the place they live, it can vary even more dramatically. So that's why it's nice to have options. You don't have to have a ton of different things, like this is my lotion for this time, this is my cream for this
summer,
time,
for winter,
for
Hawaii.
Yeah. You don't have to do that, which is why it's nice to kind of have a more multifunctional kind of product that will kind of fit most situations, and then just have a couple things just for the really more extreme scenarios.
Okay.
Like a night cream, if you're gonna be up in the mountains, tend to be really harsh on the skin, just because the dryness, and then the colder temperatures tends to be hard on skin. But if you're gonna otherwise be kind of Bay Area or something, you pretty much can find a cream or a lotion that's going to work for most skin types.
Okay, awesome.
Cool. All right.